I want to take a second and recognize all of the new members that are coming into this Facebook group. I've done a number of speaking engagements recently, and I think people are finding this Facebook group and just joining up, which I think is fabulous. I'm Dr. Wells. I'm a sleep medicine and obesity medicine physician, and I have this group to promote evidence-based treatments for obstructive sleep apnea. I can talk on all things sleep, including insomnia, central apnea, restless legs, narcolepsy, blah, blah, blah. But the people in this group have obstructive sleep apnea, and they're trying to get fully treated without sacrificing comfort or sleep. So welcome. I'm so glad to have you here. There was a recent question that came up a couple of times as I was in the Q&A section of my talk. And I just want to highlight the fact that a lot of people are being diagnosed with sleep apnea in alternative ways now. So since the pandemic and the increase in telemedicine appointments, a lot of folks don't even have a sleep doctor they can point to and say, this is the person I talk to when I need information about sleep apnea treatment, or I need treatment alternatives or help with the therapy. So some people just get the prescription from an online physician whose job it is to just hand out PAP machines. Now, historically, CPAP, or continuous positive airway pressure, was the gold standard for obstructive sleep apnea care. Nowadays, a lot more folks are being prescribed what's called Auto PAP. So auto adjusting positive airway pressure. And I want to review the differences between the two and talk about how you might end up on one or the other. So with CPAP, the C stands for continuous, and you're having just that continuous airflow that's meant to hold open or stent open your airway and keep it supported so you can breathe normally during sleep. So you get that continuous airflow. And there's a couple of settings that can be engaged so that you have a more comfortable experience. You can increase or decrease the humidification setting, and you can turn on something that's called expiratory pressure relief, EPR, or C-Flex. Depending on the machine you have, this is where you engage one of those two settings. And when you exhale, the pressure backs off a little bit so that you can exhale without effort. So you should have a passive exhalation. With Auto PAP, the machine is programmed with a range of pressures. So again, CPAP is one pressure, Auto PAP is a range of pressures. A lot of times the range is 5 to 16 or 4 to 20. It depends on the preferences of the doc writing the prescription. Now, I'll insert a little bit of my bias here. I don't like to see pressures of 4 for adults. 4 is usually not enough, and you can feel a little bit air hungry as you're using it. So I like to start with a bottom level pressure of 5, and I like to cap the top pressure. I don't want to just leave it at 20 forever. I want to look at that top level pressure and see if the range can be narrowed so that you're in more of a physiologic pressure for you. So there is some customization needed for Auto PAP. Auto PAP is usually prescribed after a home sleep apnea test or an in-lab sleep study diagnosing relatively uncomplicated obstructive sleep apnea. So those are two ways that Auto PAP would be the preferred method. The machine detects resistance in the circuit by sending out little test puffs of air. And if there's resistance to that airflow, that it interprets that information as obstruction of the airway, and it has an algorithm to start ratcheting up the pressure. Now, this algorithm is not always compatible with your physiology. Here's an example. If you have much worse obstructive sleep apnea during REM sleep or dream sleep, which is very, very common, Then when you go into dream sleep, the algorithm may be too slow to ramp up that pressure and support your airway like it needs to be supported. Sometimes people just go back into non-REM sleep and they're not getting the REM. Sometimes people are woken up because they have an airway obstruction that causes them to awake and disrupt their sleep. So Auto PAP is not always the best route, and it takes some seasoning to figure out how to solve a problem like that. You can have a better experience with Auto PAP compared to CPAP, and the reverse is also true. You can have a better experience with CPAP compared to Auto PAP. So that's one thing to put in your mind and determine if part of the issue that you may be having with CPAP is related to the pressure mode.